When we plant a seed, we don't just leave it to grow on its own, we nurture it. Likewise, care and precaution are a continuous process during pregnancy, and one of the major parts of the checkup is the abdominal examination. Abdominal examination consists of three elements: inspection, a visual observation of the abdomen for size and shape of the uterus, changes in skin during pregnancy like stria gravidarum, linea nigra, and presence of any scar. Palpation includes measurement of fundal height for gestation age estimation, determination of fetal lie and presentation through abdominal grips, and descent of presenting part in last trimester. Auscultation, detecting fetal heart rate. Before conducting examination, it is essential to inform the pregnant woman about the procedure. Ensure her bladder is empty. Also, ensure privacy and make her comfortable. Ask the woman to lie comfortably on the examination table on her back. Ask her to loosen her clothes and uncover her abdomen. Look for any skin changes or scar over the abdomen. For checking fundal height, ask woman to keep her legs straight. The fundal height indicates the progression of the pregnancy and growth of the fetus. Place the ulnar border of the hand on the woman's abdomen starting from the xiphisternum, which is the lower end of the sternum, and gradually proceed downwards toward the symphysis pubis, lifting the hand between each step down till resistance is felt. To estimate the gestational age by using a measuring tape, measure the distance in centimeters between the upper border of the symphysis pubis and the level of fundus along the uterine curvature passing through the umbilicus. This is the fundal height. At the level of the umbilicus, it is 24 weeks. At lower one-third of the distance between the umbilicus and xiphisternum, it is 28 weeks. At two-thirds of the distance between the umbilicus and xiphisternum, it is 32 weeks. At the level of the xiphisternum, it is 36 weeks. If it sinks back to the level of the 32nd week, but the flanks are full, unlike that in 32nd week, it is 40 weeks. In order to determine the fetal lie and presentation, let us learn how grips are performed. For abdominal grip, ask the woman to flex her knees. There are 4 grips: fundal grip, lateral grip, superficial pelvic grip, and deep pelvic grip. For the fundal grip, stand on the right of the examination table, facing towards the face of the woman. Place both hands gently on the sides of the fundus to determine which part of the fetus is occupying the uterine fundus. The fetal head feels hard and globular, whereas the buttocks or breech feels soft and irregular. For lateral grip, place hands on either side of the uterus at the level of the umbilicus and apply gentle pressure. The fetal back feels like a continuous hard flat surface on one side of the midline, while the limbs feel like irregular small knobs on the other side. In a transverse lie, the baby's back is felt across the abdomen and the pelvic grip is empty. The fundal height is also less than the period of gestation. For superficial pelvic grip, spread the right hand widely over the symphysis pubis with the ulnar border of the hand touching the symphysis pubis. By putting gentle but deep pressure over the lower part of the uterus, the presenting part can be felt between the thumb and 4 fingers. The head will feel hard and globular and the breech soft and irregular. If the presenting part is the head, try to move it from side to side. If it cannot be moved, it is fixed. If neither the head nor the buttocks are felt in the superficial pelvic grip, the baby is lying transverse. For deep pelvic grip, face towards the foot end of the bed. Place the palms of both hands on the sides of the lower part of the uterus with the fingers held close together, pointing downwards and inwards. If the fingers diverge, it indicates engagement of the presenting part. If the fingers converge below the presenting part, it indicates that the presenting part has not engaged. After completing the grips, we move on to examine fetal heart sound (FHS) and fetal heart rate (FHR). This process is done after 24 weeks of gestation. Place the fetoscope or bell of the stethoscope or probe of the Doppler on the side of the uterus where the fetal back is felt. fetal heart sounds are best heard midway between the umbilicus and anterior superior iliac spine in the vertex presentation and at the level of the umbilicus or just above it in the breech presentation. Next, examine the fetal movements. Fetal movements are felt earlier in a multigravida and later in a primigravida, usually around 18 to 22 weeks of pregnancy. The ANM should ask the pregnant woman about fetal movements at every antenatal visit. A decreased, increased, or absent fetal movement could be abnormal and should be referred to the FRU. By following these simple steps, you can successfully conduct the abdominal examination of a pregnant woman to ascertain the progress of pregnancy and fetal well-being.